Hello and welcome to the program. I'm your host, Neal Howard, here on the Health Suppliers segment. Thank you so much for joining us here on Health Professional Radio. Our guest today is Dr. David Goldrath. Now, David is a urologist working in Chicago, and he's here to talk about his experience in the Indiana University Kelley Business of Medicine Physician MBA program. It's a 21-month program offered to mid-career physicians that's designed to give them the business knowledge and the skills they need to navigate through the ever-changing world of healthcare. Welcome to Health Professional Radio, Dr. Goldrath.
Thank you, Neal.
Thanks for coming. Now, we have recently interviewed the faculty chair of the program, Professor Anthony Cox. Now, you've gone through the Indiana University Kelley School Physician MBA program. Talk about your experiences as an alum.
Great experience. I got into this because I heard about the program. I had always thought about considering going to medical school, business school during my practice, but my practice was very busy and I had kids and I didn't have the time. But then when this program came along, I thought, wow, what a great idea with all the changing milieu of medicine right now. And I wanted to be up to date and find out, really understand what the forces were that were changing medicine. And I felt that this would be a good time to get into this program.
Was your decision based more in a desire to understand what's going on as far as the business side of your practice and your reimbursements and that sort of thing? Or was it more in preparation to possibly take over some of those responsibilities if that were to become necessary?
Maybe a combination of both. Originally, I really felt that the changes that were happening were being forced upon us, and it wasn't so much the revenues that were the issue. It's just the whole system that was changing, and I didn't really understand, in detail what the forces were that were changing it. And I think that as physicians, we always care about, what we're doing in medicine, what we're doing to take care of our patients. Yes, we want to be successful in what we're doing, but when changes are being made that are out of your control, I find it difficult. And I thought this is an opportunity to get involved and to see what's going on and to see what I can do to help my practice and to help the local hospital, learn to deal with it and be successful.
As a mid-career physician yourself, talk about the efficiency, the understanding that you now have as opposed to those early years when you said that, your business was too practiced. Your practice was very busy, which is a good problem to have, but you still didn't have a handle on how it was being successful. Has that changed drastically for you now? Yeah, it has.
That was well put. As physicians, if you take good care of your patients and you treat them well and you have good results, you're busy. Okay, you're going to be successful. But some of the strategic decisions that we make. So sometimes I felt you're lucky when things work out well because you really don't have the basis to know everything that you're doing because you're busy taking care of patients. Having worked for a number of years, certainly I think gave me a different perspective on the program than maybe some of the younger people who haven't been out that long, because you have experience with hospital administrators, you have experience with insurance companies. Those types of things, take a lot of time and they're very frustrating. So I think, it gives you a little better appreciation for it when you're doing it.
Now, in addition to the appreciation for that thing that kind of drives you sometimes in order to help patients above and beyond your oath to heal and do no harm, what type of changes have you seen when it comes to interacting with patients now that you have this deeper understanding of what drives the business?
Well, again, I think when patients come to see you, they're coming for a medical problem, that type of thing. What you see a lot of the insurance difficulties that they have, and you see what's happening with the deductibles going up and, the premiums are going up. And you're hearing a lot of complaining about that. I understand that. At least I understand the reasons why they're doing what they're doing. I think my perspective on the whole ACA and these changes have changed. As a physician, they kind of force it on you, and you're very hesitant to take it in and say, to take it. Doing this program really changed my outlook on it, saying, okay, now I understand why What's the best way to deal with this? Are there things that I can do as a physician to help my patients out, to help them understand what's going on with this also? I think it's helpful to understand the other side, the business side, what companies are going through, what the government's going through. Mm-hmm. At least to understand that something had to change. We get very comfortable in medicine. You make a decent living doing what you're doing, but and you keep getting cut here and you're getting cut there. But when you understand it, then if you go back and you look at it and say, well, what can we do differently to give the patients better care, more value in what they're doing? Those are the types of things that you learn very early on in the program, and I think it's quite beneficial.
Do you think that one of the benefits of the program is being able, I guess, to change the way that you do your business, the way that you procure your supplies, the way that you deal with pharmaceutical reps when they come to you? Has any of that changed, or is it pretty much business as usual, but now you understand where everyone's coming from?
No, we've made a lot of changes. What's great about this course is you're doing things, at least in my practice, there's so many things that ideas that I had when I started doing this program and getting into these classes. I tried to use, real-time examples to try to make changes in my practice as we're going along in the courses. For instance, in our organizational development and change class, in our operations class, a lot of the assignments were to come up with a change, and I would do it in my practice. Mm-hmm. We instituted a in-office pharmacy based on one of my courses. We did the whole financial thing for it, and it's been great for the patients. It's been great for the practice. And those type of things we could integrate right away. So I was doing this all along in the program, which made it more fun for me, obviously, and certainly you're more involved in it because it's your practice. So I found that very helpful.
In wrapping up, Dr. Goldrath, when it comes to hiring and managing staff, training staff, have any of those approaches changed for the better, or at least for the more efficient? I think efficient is better as a result of your completion of this 21-month program.
Yeah, I think it's done a lot. We have a lot of classes in leadership, and you learn how you are as a boss. You learn how you are as a leader, where your deficiencies are, where your strengths are, and it makes you think about, how do I want to approach the situation? What do I want to do with my employees? And yeah, it's been very beneficial, and the employees have really enjoyed it. I've changed some of the things we do in practice we got our Six Sigma green belt in one of the classes that I was in, and I've tried to discuss this with my employees, and we've got projects going in our office now and engaging them into the changes in the office. And they respond very well when they're involved in the process. So everybody likes it. I mean, they're all pleased that I took the program too.
Well, some great information about a great program. I thank you for talking with us today, Doctor.
Thank you.
You've been listening to Health Professional Radio, this Health Suppliers segment of the program, and we've been in studio with Dr. David Goldrath, urologist in Chicago, who's an alumnus of the 21-month program offered to mid-career physicians known as the Indiana University Kelley School Physician MBA program. It's a program that's designed to give physicians the business knowledge and skills that they need to navigate through the changing world of healthcare. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes and SoundCloud.